So our topic is Veterans Service Agency. My name is Destiny Dugan.
I'm Sloan Whitford.
And I'm Victoria Anderson.
And I'm Laniah Stevens.
So I will be going over who Mr. Harry is and more information about what the VA is. So what Mr. Harry does, he administers the homeless program by managing 5 different programs within it. These programs include Section 8 housing, or known as low-income housing for veterans, shelters and temporary shelters, employment, and community outreach. Mr. Harry also incorporates national policies and transfers them to local policies for the staff to follow, ensuring veterans get the proper care that they deserve. So going into more detail, he basically will take policies that come from DC and will turn them into local policies to make sure that the veterans are getting the most amount of care that they can. Next slide. So more about the VA. So Mr. McCurdy works at the James A. Haley Veterans Hospital located in Tampa, Florida. Funding comes from the federal government taxpayer, and each year federal agencies receive funding from Congress. This is known as a budgetary resource. And for the 2024 year, the VA received $405.83 billion, and this statistic comes from usaspending.gov. All right, next slide. So more about the VA. There are about 150 social workers that work at the Tampa VA. And this is specifically in Tampa. Salaries between 80,000 and up to 160,000. And in the entire VA, there are over 17,300 social workers, making it the largest employer of social workers in the nation. So going into more detail about that, there are a lot of opportunities for social workers who want to work with veterans because there are locations all over the nation, so they could live anywhere and work anywhere. Next slide.
The population served and number of clients served by the agency. The populations that the VA hospital serves are veterans who have served in combat zones such as 9/11, Iraq, the Gulf War, and Afghanistan. Veterans with service-connected or non-service-connected disabilities, low-income veterans, any veterans exposed to any type of harmful toxins, and the number of clients served are 9.1 million veterans each year, 365 days, 24/7. It's the largest integrated healthcare system with 1,380 facilities, 170 medical centers, and 1,193 facilities. Are clients voluntary or non-voluntary? The clients or patients at the Veterans Hospital are voluntary. The patient can receive treatment and leave the facility as they feel. They don't have to stay. The VA must prioritize informed consent and respect a patient who doesn't want treatment. Eligibility requirements, referral sources, and waiting period. To be eligible, you must have served in the military and be discharged under conditions deemed dishonorable. You can be referred by your primary care provider only within the VA system. Waiting period is based on your care and the type of care you need, but you must be enrolled in the VA to access these services. Social worker duties, activities, and services provided. The social worker main duties at the Veterans Hospital or out of the hospital are to ensure the continuity of care, evaluation, treatment, and follow-up procedures. Additional tasks include providing psychological support to veterans and advocating for the patient's care and treatment.
So different things that bring clients to the Veterans Agency is healthcare issues, whether it's physical or mental health, substance abuse, and homelessness. As far as their caseload size, it does vary. Mr. Mr. Harry, who we interviewed, said on average, he usually handles about 40 cases at a time. There's no designated minimum or maximum caseload size, so it kind of just depends on the needs of the clients and what the social worker feels capable of taking on at a time. Next slide, please. This is just some important statistics I found that I thought were relevant and kind of shocking. It says the top health issues among military veterans is they suffer from sleep problems. 84% of veterans, 83% of veterans suffer from post-traumatic stress disorder. 77% of veterans suffer from anxiety, and 72% suffer from depression. So I thought that was pretty extreme and just shows how much the VA system and agencies are needed for these veterans. Next slide, please. The different programs and services. They do offer health care, whether it's physical or mental health, financial counseling, just to help them learn how to budget and handle their finances properly. A lot of these veterans are low income, so this helps them properly take care of themselves with the finances they have. The veteran readiness and employment, that helps veterans transition from, the military into the civilian sector, finding a job, helping them with their resumes, and all of that. The homeless veteran care just helps give them the resources that they have to help with their homelessness, whether it's grants or different things to get them housing. Independent living is different agencies that they partner with for, again, to help with homelessness. Next slide. Where the services are provided. So they don't just offer services at the VA agency. They do offer to come to clients' homes. They go to community centers. They go to living facilities. And then, of course, they also all offer virtual care as well. Next slide, please. The social problem as a whole is just veterans getting the assistance they need. When they transfer out of the military and come back into the civilian world, they have to find housing, they have to find employment. A lot of veterans come out with disabilities or restrictions that they didn't have prior, so they're not used to navigating that in the civilian sector. Just also having the support system they need to go through all of that. So the VA helps with all of that as well. Next slide. The historical data, I thought it was important to include these graphs here because it gives you a visual of how much the VA programs and agencies are actually helping with these veterans issues. So in the top model here, you see the reduction in veterans homelessness from 2010 to 2023. And as you see, it goes down drastically. And it states that 52% decrease since 2010 to 2023. So that's a huge impact and shows how much the VA is actually helping these issues become less of an issue. Next slide.
Okay. So, how services provided contributes to the advancement of human rights. I asked Mr. McCurdy 4 questions, and this is the first of the 4 questions that I asked him. The first question was, how does the services your agency provides contribute to the advancing the human rights of the populations you serve? His answer was that the agency advances the human rights of its clients by providing housing and essential support, thereby restoring their dignity and helping them transition from homelessness. These services ensure that clients have a safe, stable environment and access to the resources necessary for their well-being and self-sufficiency. Next slide, please. The next slide is about the methods used to evaluate the effectiveness of their services. What methods does your agency use to evaluate the effectiveness of its services? Mr. McCurdy answered that the agency evaluates the effectiveness of its services by utilizing outcome tracking surveys, and these surveys are administered to the clients to assess their well-being and measure the impact of the services provided. This method helps the agency gather feedback and make informed changes to improve their service delivery to their clients. Next slide, please. The barriers to providing services to clients. What are some of the main barriers your agency faces in providing services to clients? Mr. McCurdy answered that the main barriers the agency faces in providing services includes insufficient funding and issues involving housing for the veterans, such as the shortage of affordable housing and evictions the veterans face, which may hinder the effective service provision. Next slide. Okay. Strengths versus challenges of the agency. What would you say are the strengths of the agency? Are there any challenges? Mr. McCurdy considers the people who work at the agency to be its biggest strength. The dedicated and compassionate staff provides invaluable support to the veterans and their families. The challenges include navigating the differing and sometimes conflicting personalities that you may experience working with veterans and their families. Despite this, the team's commitment to the well-being of their clients and providing effective service illustrates the strengths of the staff. Next slide.
Extent of national statistics. What is the financial burden of medical care among veterans in the United States? TRICARE is a program for uniformed service members, retirees, and their families provided through the Department of Defense, also known as DoD. VA healthcare is for veterans provided through the Department of Veterans Affairs, and they don't pay minimum for deductibles for VA care. 12.8% of veterans aged 25 to 64 had problems paying medical bills. 8.4% had forgone medical costs. 38.4% were somewhat or very worried about paying future medical bills.
And these are the local statistics from the issue discussed in the previous slide. VA healthcare costs. In 2018, the VA spent an average of $13,500 per patient on disabled veterans, which was almost 3 times the average for other veterans. VA healthcare copays. For veterans in priority groups 7 or 8, the copay for the first 90 days of care is $1,632 plus $10 per day. For each additional 90 days of care, the copay is $816 plus $10 per day. As far as veterans' financial health, according to the Military Family Advisory Network, 75.8% of military and veteran families report carrying debt. 51.2% of military and veteran families say that they've had difficulty saving money in the last 2 years. Next slide.
Integrations from our bibliographies. My article is about the experiences of women veterans as they transition to civilian life. Women face many challenges transitioning into civilian life due to the hyper-masculine culture of the military and lack of support they receive after service and coming home from the military.
My article covered the relationship between social exclusion and PTSD in older veterans. I learned that these weaknesses could strengthen the impact of post-traumatic stress reactions, and understanding the connection could further help researchers and social workers service veterans who may struggle with PTSD and social exclusion. Based on Mr. McCurdy's experience, he has not run into clients or cases where this appears to be the case, but stated that it is on a case-by-case basis, and every client and every case is different. Next slide.
So I also did a article based on PTSD, but mine was more specifically on the risk factors of the presence and persistence of PTSD following a traumatic brain injury in U.S. service members and veterans. So according to Mr. McCurdy, approximately only 10% of the veterans at the VA suffer from PTSD. And looking back at Destiny's statistics, you can see that almost 80% of veterans suffer from PTSD. So I was kind of shocked when I heard that he only sees 10% of them because there's a huge amount of veterans that suffer from PTSD. But for treatment wise, those who have PTSD, those veterans receive mental health services from the VA to help them recover and heal. Destiny muted.
Sorry, so my article focused on COVID-19 and how it impacted service-seeking veterans with PTSD and depression. Throughout that article, it actually showed that COVID did have an impact and intensify their PTSD and depression due to the limits that they had because of COVID-19 on getting their services. Mr. McCurdy, the social worker we interviewed, actually said that he didn't really witness too many clients stating that COVID had an impact on them, which was kind of surprising compared to what I read in the article. But again, like Laniah said, every case is different, every veteran's office is different, so that was interesting. Next slide.
Our perceptions, my perception of the VA is that they treat their patients with the utmost respect. I have a cousin that is part of the VA, and she tells me all the time the many benefits of the VA provides for her and that she volunteers her time there, being that she is a retired veteran. I feel the VA is great because they cater to a specific group of people within the military and can better assist these patients?
So, my mother also works for the VA, and I've seen her go to court all the time and to represent clients, and also I've seen her on like the news. And currently, she's been doing a lot of like therapy and going to nursing homes, and so I know a bit about veterans health, but I never realized just how huge the VA is because as you saw before, like there's VAs all over the country with thousands of social workers, and so there's countless of many amounts of opportunities that are available to social workers who want to work with veteran services. And to add, like, there's so many services that help veterans across the nation. And being in the military myself, like I'm an Army reservist, and if I stay in the military longer than my contract, and knowing that I could, somehow use these services, it's just comforting to know that there's just so many I could use.
Before beginning this project, I did not know much about veteran services and social work, but after learning exactly what the job entails and doing research into specific issues veterans face, it's really given me new perspective and made me consider looking into this position as a future career. I truly believe the work they do is vital to the demographic they serve and that there needs to be more social workers and veteran services in general.
So my perception is pretty intense and personal because I myself am a veteran and I actually shattered my foot when I was deployed. So I go to physical therapy and stuff at the VA office. So that plays a whole huge role in my life. And I honestly I didn't know about so much the social work side of the Veterans Hospital because I dealt with more of the physical therapy and like the physical health side. But just like doing this and interviewing Mr. McCurdy, I definitely learned a lot and it brought light to like what's actually available for me out there and what social workers do actually at the VA Health as well. These are our references, and those are some more references. All right, thank you guys for
Thank
watching.
you.